Our next session, for our next and final session for this morning, I'm very pleased to introduce one of our very own from KFMC, Ms. Jane Wilshaw, who joined King Fahd Medical City as the executive nurse leader in November 2010. She previously returned to England as the interim director of nursing and midwifery with Wirral University Teaching Hospital Foundation Trust, a large tertiary and secondary care hospital. She worked in Saudi Arabia as a senior advisor to the CEO and associate executive director of training, and is an experienced NHS executive director with professional operational management and international health advisory work at ministerial level to support the reconstruction of the healthcare system in Iraq in 2005 and 6. She has 17 years executive board experience with well-developed strategic, entrepreneurial, and leadership skills, allied to a performance orientation that delivers against targets, and a track record of achievements that demonstrate a variety of competencies. Ms. Wilshaw is passionate about developing leadership skills in healthcare staff, and ensuring the focus of everything we do is our patients. Please help me welcome Ms. Wilshaw.
Thank you very much, Suzanne, for that lovely introduction. I'm glad I got the passion in there, so it's written before I go into my presentation. I am absolutely passionate about getting things right for our patients and their families in the care we deliver. And I'm delighted to have been invited to talk about the nursing story here in KFMC, and how we are working hard in a tertiary setting to engage our patients. Great, isn't it? This is nature. You'll see a little bit more what this means later on. So I'm going to talk about, initially just to put the context and an introduction, and then talk about, well, why innovation? Why do we need to innovate to get it right for our patients and their families? Then I'm looking at a patient and engagement framework. The research out there is so much, and I've very fortunately focused on one which is from eHealth in Washington, D.C., believe it or not, which actually gives us a really good framework for engaging patients. Then briefly looking at the dimensions of organizational culture, and there's been a lot about that over the last 2 days, so I'll just skim over that. Then looking at some of the nursing innovations that we are working on here, and the methodology that we're using, and then next steps. So onwards. Our nursing vision is aligned to the KFMC mission, vision, and values. We worked hard, actually, to get these words right because they mean a lot to us. It's about being the regional benchmark in the delivery of excellent, compassionate patient and family-centered care. This is in partnership with the wider KFMC healthcare team, and that's so important that we get this multidisciplinary, interdisciplinary working right. And our vision is actually to be recognized for the nursing expertise we offer and to influence policy and practice across the region. So we are ambitious. So why innovate to engage patients? Because if we are able to engage our patients, we know that will lead to much better care outcomes. The evidence is out there, time and time again, and yet do we always do it? Perhaps not. So who knows what they need best? Well, the patient really knows what they need, and we need to make sure that we help them achieve that. And actually, by involving and engaging them, what we're doing is encouraging them to use their own creativity, ideas, expertise, as well as our staff. and actually engaging them and motivating them in their best optimal health care outcome. Now, we've heard about innovation and the risks, and there'll be a little bit more about that in a minute. But actually, the sky is not the limit. We know that now. We have a universe. But we have to remember the patient safety. And we've heard about incremental innovation. We've heard about fast innovation. Apple is a really good example. I wasn't aware it was only 6 months. Wow. And yet in healthcare, it's maybe 17 years to get a clinical innovation implemented. So, to be or not to be in healthcare, we are a very risk-averse industry. And rightly so, because we have people's lives in our care. I actually quite agree with John Cage, an artist. I can't understand why people are frightened by new ideas. I'm frightened by the old ones. I love that one. And then good old Franklin Roosevelt. The only limits to our realization of tomorrow will be our doubts of today. And just one more, from Leo Tolstoy. Everyone thinks of changing the world, but no one thinks of changing themselves. And that's very true, isn't it? And this is how we often feel when we're being changed and all the change is going on around us. It is really freaky with this wireless technology, isn't it? Nothing to hold on to. Even nature, very innovative. Perhaps his wings were tired, needed a lift. So to go back to business. This patient engagement framework that I mentioned earlier was published in Fierce Health 2012. And it really is an interesting way of putting it. And for me, it actually formulated the intuitive work that we're doing as a nursing team with our colleagues. And the patient, what they want is to be informed. And we need to do that right from the beginning when they arrive. Not only informing them about their care, but actually when they're going and what's going to happen along the way. So they're clear. They want to be engaged. Now, did some work with lean methodology in my past. And when we had a patient group, what they were saying to us was, we come in there, we get into a bed, you undress us, we become institutionalized, but nobody tells me what my day is going to be. Just give me a diary. Just give me a sequence of events. Just come and tell me after you've all talked about me over my bed what is happening to me. Engage me. I'm here. I'm the patient. I'm the one that you're dealing with. Please engage me. Now, we do try. I know we know this now, and we do try really hard. I'm not sure if we're there yet. And empower me. Now, we're using SMS to make sure people turn up at the right time. We're sending texts, we're sending emails, all sorts of things, really to make sure that the patient has the knowledge, the information that they need. And then be my partner. I actually really want to be involved in my care. I want to understand and have knowledge of the techniques and the tools that you're using. Help me to do that. And then support my e-community. And we've seen some wonderful innovations from our home care team, looking at how we can better support our patients earlier at home. So briefly, you have the innovative organization at the middle and the culture that you require to make that innovation are in those circles around it. The resources, the information, the targets and the measurement, because without measurement it doesn't happen. We've heard that again. The tools, the rewards, And this event is about recognizing, giving people an opportunity for their voice, and then rewarding. It is a remarkable event, and I thank the team for putting it on. It's a really interesting start for the future. Relationships, networking, not only locally but internationally, and risk-taking, which I touched on earlier. Really important to get the balance right, but you have to take risks to innovate. So, how do we implement? We unlock the untapped power of the human brain. And some of that lightning strike is about unlocking our brains. Steering those ideas and idea generators in an actionable direction. And we now have a director of innovation here. We have a team, and what we're about is actually supporting our people with the ideas, generating that momentum that will overwhelm the resistance to change. And we talk about change and resistance a lot in nursing. And we use a model, the Kubler-Ross model. We know change is difficult. It's a challenge. But it's also exciting and a real opportunity. And then what we have to do, and we've heard about hardwiring, we actually have to embed the innovation. We have to get the infrastructure there into our daily practice and routine. So how are we doing it here? How is nursing doing it here? We had to start by defining what nursing meant, what it meant to our patients, and what they required from it. And we developed our model and philosophy of care, HOPE at KFMC, which is holistic, patient and family-centered, and evidence-based. And if any of our nursing staff meet me in the lift, they always get asked, "What's HOPE?" And they're brilliant, they answer. Then we have our implementation of the transformational model to make all this happen. We're aiming for this world-class clinical practice systems and processes. We now have nursing education and workforce development. And we have our gold standard events, which are the work to hardwire and embed practice. When you look at the evidence out there, the leadership of innovation and of change is so important. And one of the things that we are developing here is a nursing and then a clinical leadership institute. And that is about developing and making sure that leaders from the bed to the board are supported in the work they do. This is the vision of the model that we use and we know and we love, and it's built from the work from Jean Watson, The Science of Caring. The patient and family-centered approach is from the Pickers Institute and the Institute for Patient and Family-Centered Care. And for the evidence-based aspect, we are aligned with Joanna Briggs and now the Global Network. It is an ethical framework. It is our guide, and it minimizes variation. And that was really important, particularly with accreditation, to make sure that our staff who come from, I've heard today, up to 56 countries internationally, that we all understand the basis of the standards of the care that we need to provide. So the gold standard events, I've mentioned them, they're the way we embed and hardwire. This is the journey that we've been on over the last 2 years. And we're actually ending up now, which is really quite exciting after all the work that's gone into documentation and becoming a paperless organization, in actually implementing the electronic record. Starting as I speak as a pilot in the Children's Hospital. All the work we've done in preparation is revising, refreshing, getting it right, reducing our documentation from 346 forms down to 18. And that is significant. Another one of our gold standard events that I just want to touch on was about developing meaningful and measurable goals with patients. This is one of the areas that we didn't do well in our accreditation. We've worked hard to try and get this right. But there's no point us having the measurable goals if the patient doesn't know where they're going. So there's a lot of work going on in all the disciplines in KFMC to try and get this right. Another one which is really patient-focused is our care rounding project called iCare. It is a culturally sensitive model. It is taken from best practice. And internationally, it's the 5 Ps, but we've introduced it as the 5 As. I won't try and read them out because my pronunciation is not brilliant. And I don't want you laughing at me yet. But it is a proactive approach. It is about engaging the patients, and it has shown in the pilot stage real benefits. We are now nearly through implementing it across the organisation, and the staff are actually sending me emails saying how much they've enjoyed implementing this and what a difference it makes to them as well as our patients. And we know, happy staff, happy patients. Now, this guy, he's great, isn't he? The innovative things that people can do with a watermelon. One of the things we are working hard on in the leadership team is about releasing staff innovation and moving from that traditional hierarchical model of leadership towards this partnership model. And within that partnership model, the aim is that you actually start releasing innovation and letting people understand they have an opportunity to tell us their ideas and then for them to be worked on. So just a quick look at what's happened in nursing over the last 2 years. The ones in black are things already embedded in practice. The ones in white are things that we have as ideas and are working on and are being piloted in different areas. So involvement, the plan of care, actually working it out with our patients and their families. The menu, very simple. Actually helping people to fill it in and decide what they want. iCare rounding, the project I mentioned just now. Daisy Awards, these are about rewarding compassionate, extraordinary nurses, something that we're working with from our colleagues in the United States who started this. We've had our first awards ceremony and it was brilliant. It's about patients telling the story of why a nurse made a difference to their care. Another one that's going on in Main Hospital at the moment is looking at the preferred patient preference. And this is aligned to in hotels, where you keep a database of what people like when they come, so that you know the next time for a patient who has to come back, who maybe has a chronic illness, what they want without asking. And what a surprise it is to them when they have a welcome and they know that you know what they're looking for. Protected time. It's important for patients to be able to eat their meal and not be disturbed. Medication rounds. That's still a bit of a struggle, but it is important that nurses are not disturbed when they're doing their medication, because then they might get it wrong. Outpatients. One of the things we've worked on with the new outpatient electronic record and is embedded in it is actually identifying the patient expectation for that visit when they arrive, because their expectation may be totally different to the doctor. And we know that when we get feedback from our outpatients, part of their dissatisfaction is that all their concerns weren't met. But maybe that wasn't why the outpatient clinic was there in the first place. So it's important to have that discussion beforehand. The patient journey, making it as simple and straightforward as possible. Now, one of the challenges we have here with our 56 different international colleagues, as well as the advantages you get from that, is actually the language. Then we have our new electronic documentation system, CNG, Cortex New Generation. And again, at the moment, our medication, you've heard from Najwa this morning about how we are implementing and piloting this in Children's Hospital again. It looks at admission to discharge and beyond, making that pathway clear both to the staff and to the patients. Patient access to medical records. Again, this is in white, so it's not there yet. And HIMSS, we heard about how difficult it is to achieve level 6. Well, the ambition here is level 7. So what next? What we're doing now is actually working through this on surfacing innovations and the solutions to the key challenges that we face. What we're trying to do is analyze the critical elements of KFMC and to help to continue to create the environment that fosters new approaches to clinical and business challenges. Apply structured thought techniques to spur productive and creative thinking. Building this adaptable and agile culture, very difficult in health. Recognizing the importance of adaptability and innovation in a changing, complex, and outcomes-focused healthcare environment. Assessing and addressing department and personal barriers that inhibit innovation and perpetuate resistance to change. And they're there. We know it. We know where they are as well. So we have to work hard on actually moving those barriers. And then from theory to practice. Looking at some meta-analysis that was done, it is very clear that leadership is one of the key ways of helping us make these changes and actually to get and model the development. Adopting strategies to implement and hardwire innovation effectively. So, brainstorming? Maybe that's what it was about. One of the pieces of work that we did at our last Leadership Away Day was actually a Delphi study. And we had nursing from over the organisation submitting their thoughts on what they thought were the research priorities for the next 2 years. From that piece of work on that day, we managed to hone down to 10 research projects and projects that are now part of our leadership development program, much to the chagrin of some of the leaders. I think they're finding it a struggle, but they're supported with project and research development sessions and a mentor from the Director of Nursing Group. So these were the things that we were going to be looking at, and I was thrilled to find that hope was actually at the top. But also, next, factors affecting patient satisfaction, enhancing evidence-based practice and patient outcomes, effective leadership and management styles in a multicultural work environment, really important for us. Effectiveness and efficiency of various education strategies on clinical practice. Now that is a huge task. Nobody has actually managed yet clearly to show the benefits of education. We know it intuitively, but it's very difficult to prove. The impact of patient safety goals on actual patient safety. Evaluation of clinical nursing interventions and improved quality nursing care. Correlation between nursing care practice and patient outcomes. Factors to attract and retain nurses here at KFMC, and effective communication strategies. That should probably be nearer the top because communication is one of the most difficult things to get right. Thank you very much, and I think we're going to be having discussion and questions as part of the panel, but here's another innovative way to use an apple.